Hi, I'm Lisa Murawski with the Legislative Analyst's Office, and I'll be talking today about a report entitled Maximizing Federal Funds for HIV/AIDS, Improving Surveillance and Reporting. Although media coverage has waned, HIV and AIDS are still significant public health issues. An estimated 5,000 to 7,000 people become newly infected with HIV every year. We spend over $1.2 billion from all sources every year to prevent, treat, and track HIV, and costs are also growing every year. How well we track HIV has implications for how much in federal funding we receive. The state receives much of its federal funding for HIV/AIDS programs through the federal Ryan White CARE Act. The amount the state receives is calculated based on the number of HIV and AIDS cases that are reported to the state's surveillance system. In this report, we identified two problems in the state surveillance system that result in inefficiency and gaps in what's reported. These problems affect the state's competitiveness for federal funding awards. The first problem involves the reporting of HIV test results. Surveillance usually starts when labs identify a positive result. By law, they are required to report the result to their local health jurisdiction. Now, when labs report most other diseases to local health jurisdictions, they are allowed to do so electronically. In fact, the Department of Public Health is in the process of building an electronic lab reporting system, or ELR, to accept reports for a host of other diseases. And soon, all labs will be required to report electronically. By contrast, when reporting HIV, the labs must still print out a report and send by traceable mail. This manual process is labor-intensive and inefficient for everyone involved. We found that adding HIV reporting onto the ELR system will be more efficient and will lead to improved tracking of the disease. Therefore, our first recommendation is that the legislature direct the Department of Public Health to modify the ELR system to include HIV and enact legislation requiring laboratories to electronically report HIV test results into the system. This will increase the accuracy of data collection and will allow local surveillance workers to spend more time investigating cases. A second problem we identified was that there were sizable discrepancies between the state surveillance system and other databases used for other programs that serve HIV-positive individuals. For example, one might expect that if an individual was receiving HIV drugs or other HIV-related services from the state, there would be a corresponding HIV case report associated with this individual in the state's surveillance database. However, this is not always the case. We also found there is legal ambiguity regarding whether confidential health data can be shared between correctional health systems and public health systems. We found that the department has begun taking steps to address these issues, but in order to ensure that these gaps are closed, we recommend that the legislature require the department to assess the discrepancies and perform cross-checking between all relevant databases on a regular basis. We also recommend the legislature require that the Office of AIDS report annually for a period of 3 years on the progress being made to address these gaps in the surveillance system. Finally, we recommend that the legislature change state law to allow public health entities to exchange data with correctional health systems for public health purposes. We also recommend that if the Department of Public Health determines that state statute restricts their ability to make these improvements or to accurately track HIV cases, the department should notify the legislature so that the law can be changed. Our analysis indicates that these changes would make the state's surveillance database more complete, improve the state's knowledge of disease trends, and make the state more competitive for federal HIV/AIDS funding. This concludes the webcast. This report can be found on our website. Thanks for tuning in.